The facts in this case, in my view, suggest that virtually none of the safeguards for sedation were in place when propofol was administered to Michael Jackson. As an anesthesiologist, I will tell you the worst disasters that I have seen in practice have been during sedation. It's not in the big cardiac surgery, brain surgery, where everything is set up. The worst disasters occur in sedation, and they occur when people cut corners. It was an egregious violation because Michael Jackson died because he stopped breathing. That's expected. Not the death, but the stopping breathing is expected when you give intravenous sedatives. And the airway equipment, you just put in an oral airway or a nasal airway, and you open it up, you remove the tongue from the back of the throat, and you open up the airway so oxygen can flow back and forth. That might be all it takes. It should be there without question, and the fact it wasn't there contributes to the bad outcome that was observed. It's an egregious violation. No competent physician would give these drugs without having emergency airway equipment present.
I want you to assume that Michael Jackson was laying in bed, Dr. Murray left him for 2 minutes, and 2 minutes only, and came back and had this airway equipment. What would have transpired if the doctor had been competent and observant? Would the patient be able to be revitalized or resuscitated?
Yes. The most likely thing that happened was airway obstruction. Michael Jackson was trying to breathe, but the tongue had fallen in the back of the throat. Either a simple chin lift, just that alone, or an oral airway to move the tongue out of the way might well have been all that was required to save his life.